Welcome to Healthy Pets, Healthy Owners. I'm your host, Dr. Edmund Sulkowski, and I'd like to welcome our guest today, Mr. Tom Yakopin.
Thanks.
Mr. Yakopin, how are you?
I'm doing well. Thanks for having me.
It's a pleasure always to have you on our show. Tom is always a guest on my radio show, Healthy Pets, Healthy People. We cover a lot of topics regarding health insurance and health care and the differences. And Tom is owner of West Penn Life Health here in Washington, but you're a national organization.
Right.
And you service the whole country.
Correct. Yeah, I have another company called New Era Health Plans that is a national outfit in 28 states, correct.
You know, I think, Tom, there's a big misunderstanding about what is health care and what is health insurance. So I would appreciate your expert definition of those terms. What is health care, in your opinion?
Well, certainly. Health care is what occurs between a provider, which could be a doctor, a gynecologist, a podiatrist, a dermatologist, and a patient. It is the simplest, purest interaction between somebody who has the wisdom, skill, knowledge, and the ability to treat a malady and somebody with a particular problem, whether it's chiropractic, I threw my back out of whack, or whether it is, you know, I have a skin rash or whatever. That is health care.
So that's actually going to a provider for a condition or a symptom that you have,
Right,
and asking for treatment and help to resolve the issues of that condition.
It couldn't be more obvious.
Health insurance is totally different, but somehow there's been a confusion, and we seem to have associated the term health care with health insurance. And I think that happened with when Obamacare came in.
Perhaps, and I might say you could go back to the early 90s. I lived in Cincinnati at the time and was actually launching that national organization that we were discussing. And in the early 90s, there was a clarion call for health care reform. And if you recall, at that time, President Bill Clinton, you know, was in office, and you know, there was a lot of talk about Hillary Care. But you know, then the government and the media began to intersperse or began to use health care as a crisis topic, the narrative. But immediately then the cameras would move over to what? Health insurance, and how we need to fix health insurance. In fact, several states, Kentucky being one of them in the 90s, actually was adopted a pilot program that is very similar in many ways to what Obamacare was years later in 2010.
So define health insurance for us.
Sure. Health insurance is nothing more or nothing less than a product that a consumer buys from a third-party payer, right? Whether it's a big box insurance company, like when you drive through the tunnels in Pittsburgh, the two largest buildings that you're going to see downtown are both related to insurance companies, okay? The two tallest buildings, I should say. But insurance is a product. You're buying a contract that brings a third party into the picture, and you're paying this third party a premium, which is so much money each month, to do for you what you cannot do on your own.
Meaning that if I have developed some disease that requires surgeries, and of course with surgeries comes hospital stays and great expense and
Correct.
so forth. So we look to insurance to cover a portion or a majority of that cost.
Yeah, no different perhaps than car insurance or homeowners insurance, right? We have determined that as a society that paying a little bit of money each month into a risk pool where a lot of other people are participating and we share risk. In other words, if you have 100,000 people, and these numbers, you know, are illustrative, they're not accurate, you know, examples, but if you have 100,000 people, a certain percentage of them, but only a certain percentage of them, are really ever going to have a major or catastrophic health event. You know, especially under age 65, right? Over age 65 in America, we have Medicare, which is a federal program that insures almost all U.S. citizens age 65 to the grave, okay? And that's where most of the major health risks occur, 65 and over. But under 65, if you have 100,000 people, not all of those people are going to have major medical events. A few of them are. So common sense dictated years ago that we, the people, right, we could pool our risks and pay a little bit of money into a risk pool, organize an association or a fraternal organization or an insurance company to manage that money, okay? And if or when something bad happens that is out of the financial reach of the people in that risk pool, that third-party payer would step in and write a check.
So the third-party payer is basically taking a premium from you, investing that money, hoping to make money.
Correct.
And hoping that you don't get sick.
Correct.
And that way, they're using it as a business to make money. You get sick, there is a fund then that'll cover the cost.
That's correct.
But somewhere along the line, we used to use that for when we had a major surgery requirement or a major illness.
That's right.
Accident, trauma, broken bone, something that was out of the ordinary.
Mm-hmm.
But somehow it's kind of been reduced to the fact that you get a sniffle and you run to your physician and then you expect the insurance company to pay for it.
Exactly. Well, I always like to take people on a journey years ago, especially, folks my age. I can remember my dad or my grandfather. Both of them had benefits where they worked. My grandfather worked for West Penn Power. My father worked for a branch of the federal government, and they referred to their benefits, Doc, as hospitalization. Perhaps our listening audience remembers that. Perhaps you remember that. And that's what early health insurance was. It was designed to pay what I cannot pay, okay? It makes sense, like when you think of your insurance at home. You don't have insurance on your light bulbs. Like when a light bulb goes out in your living room, you don't call the insurance company and say, hey, what's this going to cost to repair? You don't have a copay on your light bulb because it's a $5 item, right? Or a $3 item, or whatever it is. So we've never attempted to insure routine things. When your carpet wears out in your home, or the oil needs changed in your car. That's routine what? That's maintenance. When you purchased your car, you assumed that there are going to be certain financial responsibilities. I'm going to have to wash the car occasionally. I'm going to have to change the tires occasionally. I'm going to have to rotate the tires occasionally. I don't expect a third party, some other entity, to pay for this. It's not that they couldn't. It's not that Allstate or State Farm couldn't write an insurance product to cover every little ding and routine this, that, and the other thing on your car. But ultimately, what would happen to the price that you're paying? It would, of a necessity, go up, right? Very simple. Yeah. And when you look at the business model, okay, when you look at the real estate that most of these third-party payers occupy, you have to ask yourself, is it expensive real estate or is it affordable? It's usually prime real estate. So the brick and the mortar and the costs and the labor and the taxes and everything that goes into running that business, it becomes very expensive for me. Let's say a doctor visit. Let's say a chiropractic visit that I could pay cash $25 for. Why would I pay a third-party payer over here in the big city? Why would I pay them to pay you when, in fact, the simplest, easiest, most affordable way to execute that transaction would be, here's the $25.
It's interesting. I am a client of yours.
Yes.
And you've saved me a ton of money, and maybe we can address that a little bit later.
A little later, sure.
But I called up to make an appointment for my yearly physical, which is taking me 4 months to get in to see my internist. And first question out of the scheduler's mouth was, "What is the name of your insurance?" And my comment was, "You know what? I don't even know." Right. I know I have it if I have trauma, if I have a problem. She said, we have to put something down. I said, well, put this down. I'll probably pay out of my pocket.
Yeah, cash, right.
You know what I mean? It was just kind of like so strange to hear that. the first thing I want to know, what was my insurance?
Very common.
And I think that in lies the problem. Because I know some people, and I've had conversations with them, Tom, where they test for everything. It's almost like they're looking for something. They want to find something wrong with them. And I'll say, what are you doing all that for? Well, I have the insurance. My insurance covers it.
Right.
Well, so what? And I say, you're getting all these x-rays and all that's accumulating in your body, and you're doing that just because somebody else will pay for it?
Right.
And they look at me like, oh, okay, well, I guess that makes sense, but they continue to do that. And I think that's a big issue for us.
Oh, yeah.
It's almost an abuse of the system.
Certainly. Well, I've raised 4 children, okay? And one of the things that I've noticed is that the kids had a Lamborghini diet growing up when Dad was paying the bills. But now that they're all on their own and they're writing the check for their car or their house or their shoes, it's a little different, okay? And what I mean by that is when you're insulated or isolated from the cost of anything, it's very difficult for you to understand the value of a dollar, okay? And insurance actually creates a problem in many cases, and that problem is when a consumer in a normal economy, when you bought your house or you buy a pair of shoes or you buy tickets to a concert, somewhere in the negotiation you ask the question, what does this cost, right? Only in healthcare are we not asking that question. And the reason consumers are not asking that question is, what do they care? Somebody else is paying it. And therein lies another problem. For example, this is where we can discuss after the break, how that if an MRI through a large hospital in Washington County, nearby hospital, an MRI, if run through traditional billing, the big box method, you have insurance, etc., is going to be $2,250, okay? The same consumer, the same MRI, the same hospital, if they said, look, I don't have insurance, it's cash pay, they would get an immediate 70% discount. That $2,250 MRI immediately becomes $950. Why? Because it never cost $2,250 to begin with. They're using phony baloney billing that is run off of what is called in the business a charge master, which is usually behind closed doors. Nobody knows what the billing is. In fact, what we're finding is that a lot of the billing is different. It may be different for you if you have this health plan versus it may be different for you if you have that health plan. Or, as I indicated, and this is provable, a large hospital in Washington County has just come out and said, for cash pay clients, if you negotiate, we will knock off 70 cents on the dollar on products and services rendered here for cash pay clients. Why? Because so many people have big high deductibles today, even with insurance, okay, that they're becoming more consumer aware.
And that's what I was observing. I was watching my premium escalating.
Yes.
Threefold.
Correct.
Almost every year. And I wasn't using it because, frankly, I try to take care of myself, and I want to stay away from all of these doctors. I say that in just a little bit.
Of course.
But I do. I think healthcare starts with you and what you're doing, the insults you're bringing to your body, how you're supporting your body with nutrients, the type of physical activity you have, the do's and the don'ts in being well. I don't look at as healthcare to keep me well. I look at healthcare, okay, I broke my arm, now I need healthcare. I got a pain in my side, let's go find out why the pain is. So I came to you saying my premiums are skyrocketing. I don't use it. I just want health care. What did I call that? The term's slipping my mind. Catastrophic care.
Yeah.
And you sat down and said, oh, well, we can do that.
Yeah, we can help you.
So what did we do?
In essence, what we did was we bought a hospital surgical policy that is designed to cover you if you're in the hospital, outpatient surgery, professional fees including surgeon, assisting surgeon, radiology, pathology, your attending physician. And then it has limited outpatient testing and therapy for, it'll help you with a doctor visit or whatever. We'll cover up to 20 per year. But what we do is we teach people just what you described, pay cash for the small stuff, buy insurance for the big owies, the $50,000 bill, the $70,000 bill. We just paid out a claim, unfortunately, for a gentleman in Atlanta, Georgia, over $200,000, and he didn't make it. It was sad, but we just paid a claim here for a local gentleman in McDonald, over $50,000. Had a heart attack, walked away with zero out of pocket. When all the moving parts to my plan kicked in, the man had no deductible, no out of pocket. In fact, with his crisis recovery benefit, has over $2,000 cash extra following his recovery for indirect medical costs, which is often missed when people build a risk management strategy. See, what insurance really is a risk management strategy. If you had $50 million in a trust fund, would you need health insurance?
Most likely not.
No. Yeah. You are the insurance company, right? Why pay somebody thousands of dollars? Why pay $10,000 a year for the next 10 years if you're 55 aging into Medicare? That's $100,000 that could be in your cookie jar, right? You wouldn't do that if you had $50 million in the cookie jar. So we want to train people to look at insurance as risk management. You're bringing the risk tolerance down. Like I often say to people, if we had a crystal ball and you knew that you were never, ever, 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 ever going to have a claim that exceeded $10,000, would you buy insurance? No. You'd put $10,000 in the cookie jar and pay cash for the stuff as it happened.
Absolutely. Tom, we're going to go to a break here in a second, and we're going to come back with Tom Yakopin from West Penn Life Health, and I want you to define some of these terms for us.
I would love to. Yeah,
because I think they're confusing on their own.
They are.
And then talk about the proper what's changing in healthcare and health insurance.
Yes.
We'll be careful to use that term, and how we go about saving money and getting proper coverage for these things. We'll be back after a brief commercial break here on Healthy Pets, Healthy Owners with Mr. Tom Yakopin.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy! And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
Welcome back to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we're here with Mr. Tom Yakopin from West Penn Life Health. Tom, before the break, we were giving kind of a wide scope of what health insurance is and how it should be utilized, actually, and why we need it. There are some terms I'd like you to explain. What is primary care?
Sure. Primary care is the care that you would receive or expect to receive from your PCP, your primary care physician. Primary care might include a doctor visit for a cold, or little Johnny has the flu.
So that's the primary care physician is basically your gatekeeper to any of the specialties in the medical field.
Yeah.
You generally see the primary care physician, and then he or she recommends you to somebody
to a specialist.
Yeah.
I think a good primary care physician would say, let's expand that definition a little more, because a good primary care physician has the capability in some cases to read an MRI, to look at. My primary care physician looked at a heart, EKG and everything, and has a good idea of where I'm at.
We're all trained the same way. The way I look at it is, I think there's too big of a compartmentalization of health services, and everybody wants to put you into that little compartment, and nobody knows, no one takes a holistic approach to what the body's doing. And in lies a lot of problems, because you have this physician medicating you with this one medicating you with this, and everybody is referring out. And I think that needs to be addressed, but that's a whole nother topic. So what is a copay?
Okay. A copay is if a client has a traditional major medical PPO, EPO, or an HMO plan. When you go see your primary care physician or a specialist, right, usually you have some flesh in the game, meaning there is usually some cost to you, the consumer, even though you have an insurance product. You will have to render a certain amount of money at claim time in that office, be it $20, $25, $50. That is a copay. That means presumably your insurance company behind the veil is paying so much to that PCP,
Right.
that provider, and you're paying so much. You know what you're paying, right? The 20 or the 25, but you don't know what they're paying.
What they're paying. And what is out of pocket?
Out of pocket is what a consumer is paying out of their own checkbook or out of their own wallet.
So that could include a copay plus other fees.
That's correct. When you look at a traditional major medical policy, they usually have copays for things like office visits or specialists, PCPs or specialists. They may have a copay at the emergency room. They may have higher copays for various types of testing or therapy. If you're hospitalized, usually there's a big high copay known as a deductible, which means that is deducted from the amount billed. A $10,000 hospital bill, a $5,000 deductible. Well, that $10,000 bill, $5,000 of it is on the consumer. Okay, so and then out of pocket, another out of pocket or a way that the consumer participates in cost is what's called co-insurance. Many people have heard of like an 80-20 plan or a 90-10 plan. What does that mean? Well, that means that even after your deductible, the insurance company may not be paying 100% of those claims. The insurance company is paying a percentage of them.
So you're paying your deductible and copays.
Plus co-insurance. And that all goes together into this big whammy called the out-of-pocket or the maximum out-of-pocket expense.
So does that generally lower your monthly premium?
Sure. The more risk you take, the less you're going to pay the third-party insurance company.
What's a PPO?
A PPO is a preferred provider organization. That is where you have a group of doctors and hospitals over here that have joined a preferred provider organization. That preferred provider organization contracts these doctors and hospitals with this insurance company here, and there is a relationship. That relationship is if I, the consumer, go to these contracted doctors and hospitals, this insurance company has negotiated fees and rates so they don't get hosed, so that they're not paying retail or being overcharged by unscrupulous providers. These providers have agreed to the terms of the relationship, therefore they accept the insurance, right? Years ago, you never heard of, does a doctor accept this or doesn't accept it, right? And that term acceptance usually relates to the contractual relationship, either as a PPO provider, an EPO, which is an exclusive provider organization, or an HMO, which is a health maintenance organization.
And that's originally what started from the traditional health insurance. The HMO started first, and then the PPOs came afterward. Am I correct in that?
Well, traditional health insurance, when I got into the business in 1985, was mostly basic hospital surgical plans where you could go to any doctor, any hospital, anywhere. There was no agreement between the doctors and the insurance company. The insurance company's agreement was with me, the consumer, or you. The insurance company simply said, go see anybody you want. And you have a deductible, and after that deductible, we'll pay 80% of your hospital or doctor or testing fees to maybe $1,000 out of pocket, then we'll pay 100%. They had no relationship. There was no PPO or HMO or EPO. So there was ultimate freedom of choice. And frankly, I think it was a safer environment for everybody. Today, with managed care, and keep in mind the PPO, the EPO, the exclusive provider organization, which means a PPO, by the way, going back to that, if you seek treatment from one of these doctors, everything is hunky-dory. It works just the way you think. But if you don't want to see one of these docs or hospitals, you still have coverage with a PPO.
Just less.
You might be penalized.
Yeah.
You might have to, you'll have more flesh in the game. But at least you have freedom, okay? With an EPO, it's exclusive provider, okay? What does that mean? That means see these doctors and have coverage, or you don't have coverage. If you go outside of the network, you're not covered. Same thing with an HMO, by the way.
Yeah, and that's a scary proposition, because if you're not comfortable with the physician that you're seeking help from, there's a problem there.
I agree.
And to be dictated as who you can see is an issue. And often in those organizations, you never see the same physician twice.
Yeah. And I hear the horror stories, and this is, I've never been a part of one personally, so I can't speak to that. But what I can say is what I see happening with these relationships, okay, the contractual relationship between the third-party payer. Let's look at the insurance company as the person with the bucket of money. That's really what the insurance company is, right? They have a big bucket of money, and they're the knight in shining armor that ride in over the hill and write the big check when you can't, okay? That's what they're, but now what's happening is because they have contractual relationships between doctors and hospitals, unfortunately now, many private practice doctors are being swallowed up, and they're becoming de facto employees of the insurance company.
Of the hospitals and the insurance company.
Bingo.
Yeah.
Because now in some cases the hospitals are being absorbed by who? The insurance company. Mm-hmm. So now you have what I consider to be a dangerous relationship. There's a commingling of the people writing the check now through the carrot and the stick can control the provider and either reward or penalize the provider as it relates the care given to the patient, okay? And this, to me, this managed care, the rabbit hole that we're going down is creating a lot of problems that we're seeing surface today, not only for the patient, but can I say this, that a lot of doctors are experiencing burnout, okay? Mm-hmm. Because they are spending so much time today with things such as medical billing, codes, and compliance, okay? We all grew up, we all remember, not all of us, but many of us remember Dr. Marcus Welby, MD. Remember that? The television show? Those were the good old days, right? Where the doc had a little broader scope of authority as a primary care physician. He or she had a great relationship with the patient. Mm-hmm. And may I submit to you that the patient-provider relationship cannot be overstated in its importance. You mentioned earlier a good primary care physician, or in my case, I use a direct primary care physician, which hopefully we can talk about later. But my particular primary care physician treats the whole person. She gets over into what's cooking in my life emotionally or relationally or exercise or diet, all of these types of things. And the last thing she wants to do is push pills.
The other issue is you develop this relationship and they provide you with time, their time.
Yes.
What's happening with these hospital-owned physicians, and that's a simple way of saying it, they have a quota to meet during any given day, and they spend 5-10 minutes with you as they're running from room to room, and it's very difficult to develop a relationship, and often, as I said, you don't get to see them the second time you're in there, you're seeing somebody else who's ever there that day. And you need that relationship with your physician. They need to know you and understand you, because we can take all the x-rays we want, we can take all the blood work tests we want. Those are just pictures of a moment in time. You come into your provider with symptoms and signs, And any good physician should be able to diagnose you just from that alone. If you don't have but 5 minutes with them, there's no way that they can do that. You know, and those pictures and the blood work test results are confirmations. But I always look at it as you should be able to diagnose a condition by just listening to the patient.
Wow. Well, you know, and this is what I'd like to, where I see healthcare reform taking place, by the way.
What's new with healthcare
Well,
and this? What's going on here? I know when I came to you, one of the big things at the time was we got to satisfy the law and be covered with insurance.
Yes.
Has that gone away?
Well, the Republican tax overhaul this year does end the individual mandate starting with tax year 2019.
So not too far away.
Right. So the individual mandate is gone, all right? And that was a major component in the Affordable Care Act, going back to the carrot and the stick, right? I was suspect of the Affordable Care Act because it required a stick, period, okay? What I've learned in relationships or negotiation, if somebody shows up to the negotiating table and they have a big stick to buffet you into this decision, it's probably not a decision that's in my best interest.
You know, it seems to me when the government uses the term, it's just opposite is what it really means. So when they said affordable, it was opposite of what affordable meant.
Right on.
Because it was becoming difficult for me to afford it.
Yeah, and the individual mandate was something that was very contested in the United States. And that is one of the first times, if not the first time, that the federal government passed a law that forced consumers to buy a commodity from a private insurance company, such as health insurance, right? If you didn't buy it, you suffered a penalty, which is like, okay, imagine the struggling self-employed person who doesn't have health insurance because he or she can't afford it, and the government thinks it's a good idea. Since you can't afford it, I'm going to penalize you even more, you know?
Well, then it impacted businesses because they cut down employees so they didn't have to qualify for that.
There were a lot of, like anything, people read the law, they get legal counsel, how do I maneuver to avoid the teeth here or whatever. So, you know, going back to central planning, I'm very skeptical of central planning in a nation as big as the United States, because there are so many differing pockets and socioeconomic differences. And, you know, if you travel from Alabama to California to Maine to Pittsburgh, you're going to see a lot of difference. So the Affordable Care Act changing, right? We're going to see a mass exodus beginning January 1st, 2019, from the Affordable Care Act, also known as Obamacare, to more traditional forms of insurance, where a company like mine is probably set to blossom even more. And we had a record year last year, New Era Health Plans and West Penn Life Health. You know, and what the other thing that we're seeing new, and I say this to my associates, sales reps and team leaders. I've got a team leader in Georgia, Chicago, Philadelphia, Cincinnati, Draper, Utah. We're all over the United States now, and they have agencies and sub-agents that work with them. But my message to all of these people is this: the number one thing that we have to offer the American people is education. Okay? Yes, we sell a product and that's what pays the bills. But the thing that we're doing right is we're educating the consumer and talking with them about common sense ideas like why buy insurance to pay for the small stuff. You know, part of our education is teaching people about direct primary care. Another thing that we're educating people about is accessing cash pay opportunities with major health systems, such as the Washington Hospital or Heritage Valley here in Pittsburgh. Both of them are now offering transparent cash pricing to consumers. And I think that's very fair. I think it's very noble of them. And our job is to make the consumer aware that hey, here's what it is, cash pay. And sometimes they look at it and they're like, oh my gosh.
Well, you know, Healthy Pets, Healthy Owners is about education. That's what we try to do. We try to inform. The radio show on AM 1250, Healthy Pets, Healthy People, which you're a sponsor of, is about education, and I think that is key to everything. That's key to an enjoyable life, that's key to health and wellness, that's key to financial success. I don't care what you look at it. You have to know the information, you have to have the facts in order to put out a good plan. So with this reform that's going on, well, before I ask you that, and you brought this up, this cash pay. So if I walk into my physician's office and I have insurance policy with you or with Blue Cross and Blue Shield or whatever I have, do I say, before I hand them my insurance card, do I say, if I pay you cash, what's my cost?
Why not?
And should that be less than if I handed them an insurance card?
It may be. Should it be less? I don't know, but it may be. In fact, what we're finding in many cases, it is. Okay? Yeah.
So how do I do that? Do I hand them my card and say, well, let me pay cash, and if it's less, you're going to...
It's all how you posture. The consumer has all the authority in the world. Okay? If you think about it, you're a consumer. You're buying a product or service. And part of our education process is reminding the consumer you're in control. Just because they have a white coat does not mean they're your authority. They're your servant. They're here to help you. So yeah, you have an insurance product. I have an insurance policy. And I am scheduled actually for an MRI because I had a small event when I was in Ireland overseas recently. And my doc wants to look into it, okay? And when she wrote me the script, I could run it through the insurance, get the PPO discount and be reimbursed, whatever amount. Or I postured as cash pay. Why? Because I want to learn how this works, and I feel that I can help my agents and my client by walking through it some myself. And this is where I found out that the Washington Hospital, for example, graciously will give you a 70% cash pay discount over their rack rate, over their regular, what they would normally bill. And that $2,250 benchmark price for an MRI, I'm not guessing at this. I have a prescription on my desk for this MRI, and I'm the patient. And I'm going to go to the Washington Hospital and render $975, and that's all it's going to cost me. And then I'll be reimbursed by my insurance company because my insurance plan is a complete freedom of choice plan. It's an indemnity product, meaning it pays so much per procedure per day, cash, and it doesn't care who it pays it to. It can pay it to me, the insured. It could pay it to you, the provider. It could pay it to the hospital. My insurance company doesn't care.
And that's the policy that I have.
That's the policy you have, okay? And so it gives the consumer the ultimate choice. It puts you squarely in the driver's seat, and you get to negotiate the deal that is best for you. And this is what managed care does not allow for, all right? Yeah. And going back to things like direct primary care, my physician and many physicians now, I spoke with Dr. Kirsten Lee, I believe, in Allison Park, Pennsylvania. She's has a thriving practice that's practicing this. Rebecca Plute, Paragon Personal Health Care in Canonsburg. My friend Dr. Keith Smith in Oklahoma City is part of a major player in a 43,000 square foot surgery center called the Surgery Center of Oklahoma, or Oklahoma Surgery Center. They're all cash pay. They don't take any insurance. But if you go to their website, it's all transparent as well, meaning you can see what a complete knee replacement costs, including facility fee, surgeon, assisting surgeon, radiology, the whole thing. And their prices are lower than Medicaid pricing, which is the lowest reimbursement.
But that doesn't mean they're not getting quality health care.
Oh, the care is fantastic. In fact, in many cases, let's say at the Oklahoma Surgery Center, many of the surgeons that are practicing there are the same surgeons that are practicing across the street at the very large, very expensive, big box corporate hospital. And they like doing their work at the Oklahoma Surgery Center better in many cases because it's swifter, more efficient. They can get in, get their work done, get out, and it's fantastic. My relationship with Dr. Plute, Paragon Personal Health Care, it couldn't be any better. And I'm a 57-year-old male. I don't mind sharing what the pricing arrangement is. I pay $100 a month every month as part of my risk management package to Paragon Personal Healthcare. What do I get in return for that? I have a friend who is my physician who knows everything about me. She probably knows more than I'd like her to know. But if I have a symptom, I can text Rebecca, say, hey, that rash is coming back. Okay, well, send me a picture of it. And if I need to see, but it's a great relationship. And I just went there and she did the blood draw. She has a place in her shop where they can draw blood for the lipid panel to check for the cholesterol or the sugar. And she uses the same labs that any other doc does. She's using Quest Diagnostics. And she buys the lab and I just pay her, but it's peanuts. She's negotiated very low direct pay prices. So I'm not insuring any of this. My office visits, I have no copay, no deductible, nothing. My blood draws cost me very little money, right? And it's all part of this subscription. I remember, I had a little nodule or, like a skin tag or something growing on my right calf last year. And, she just froze it and took it off right there. No cost, So primary care or direct primary care is where I'm paying cash on a subscription basis.
Concierge physician.
Concierge physician. And let me tell you, it's becoming more affordable, and it is the best relationship I have ever had with a physician. Personal, no middleman. And let me tell you, if you have 100 physicians in a room, and I was just in Oklahoma City last year at the Free Market Medical Association convention, mostly all docs, all surgeons, whatever. And you can tell the direct primary care physicians in a room of 100 doctors. You know why? They're the happy ones.
Yeah.
Because they're not working for they're not working for insurance
there's
companies.
that, and the insurance companies have techniques not to pay the primary care for the physicians, the care providers. They delay. They say you messed up the billing code. There's all kind of things they do not to pay, and you have to constantly fight to get your money.
Absolutely, it's very stressful.
And then they say, well, hey, we're only paying you this.
Yeah.
It's tough sometimes. So then that impacts healthcare because now, in order to keep the overhead under control, you're having to see more people in less time.
Bingo. And this is the other thing. People notice a difference in care. People realize, how many people listening to my voice have an appointment, they show up on time, and yet they have to wait in the waiting room. And then finally, they're shuttled down the hall. You're weighed by a nurse's assistant or something. And then you sit in the doctor's office and you wait some more. And there's 10 stalls just like yours down the long hallway. And you hear the doctor down the end and he's moving quickly, here he comes. And he comes in and it's, and his back is toward you and he's clicking mouses and entering codes on a laptop, right? Mm-hmm. Why? Because he's working for corporate America. Okay, the bedside relationship in many cases is lost, and a lot of these doctors are burning out. Google the suicide rate among physicians and professionals. It's interesting what is occurring in the business, because to get ahead, these people are these caregivers are under a lot more pressure to accomplish more. They're managing more nickels, more noses, clicking more mouses. They're doing a lot of things besides caregiving. And my private physician said this to me. She went to 15 years of practice school and to care for people. But the corporate model had her caring for people 20% of the time and compliance 80% of the time. Yeah. Her new model has completely reversed that, where it's a lot more relaxed. The patient-provider relationship is at the top. That's the number one thing,
Tom, we're about to come to a close of the show. So, is there any particular point that you wanted to get across for any?
I would just say this: that what we can do for clients, if they're interested in learning more about what I do, is I would say allow us to share with you education on how to access care, primary care, affordably, simply, efficiently, and then how to manage your risk with a much more affordable health insurance plan should something major.
And there's a website out there that you can actually go that breaks the costs down?
Well, they can visit my website, which is westpennhealth.com, and then I can share with them other websites that we've been discussing, whether Heritage Valley or Washington
There was something
Hospital.
like a blue book.
Oh, yeah, I forgot. Healthcare Blue Book. That is something we're using to educate consumers on how affordably things can be negotiated and what the real price of these products and services is.
So that's healthcarebluebook.com.
.com. That's correct. Google Healthcare Blue Book. Just like the Blue Book for a car, you can now see what a CAT scan really costs. You can now see what a blood draw really costs, that X-ray really cost.
I know we have your information up on the screen from time to time. What is your phone number at your office?
724-228-7187. West Penn Life
Highly
Health.
recommend this guy and his services. It's done well for me, and you know, I've saved a lot of money. Tom, thank you so much for
Thank
coming
you,
on
sir.
Healthy
What
Pets,
a
Healthy
pleasure.
Owners. Remember, a healthy pet is a happy pet, and when you're healthy, you're happy too. Remember, you could listen and talk to us live on AM 1250 The Answer every Saturday morning from 9 to 10 a.m. We'll see you next time on Healthy Pets, Healthy Owners.